So what happens to you when you come in post-resuscitation after CPR? Well, this is what we do in the ER. So I'm going to be talking about a hospital setting code versus EMS post-ROS because they're going to have certain shit already done when they come in. So if your patient code's in the hospital, this is where we start. So during the code, hopefully you would have established an airway. The doctor would have dropped an ET tube in or cracked him something to get an airway access. So now you already have that done. You should have already had peripheral IVs or some sort of access. Sometimes it's an IO if that's all you can get. So now we move on to where a lot of your nursing skills are going to come into play. I mean, obviously they're going to be hooked up to a monitor and all that stuff, but now your nursing skills come in. So you're going to have to drop like an OG tube, which is down into their stomach through their mouth. And then you're going to have to throw in a temp sensing Foley for them. Once they get up to the unit, they'll probably end up putting in a rectal tube. While you're doing that, you're also going to be having to manage drips. So you have to keep the patient sedated. So like what we usually use is propofol and fentanyl. Depending on what their blood pressure is doing, you might have to have a pressor going. I've also seen them throw art lines down there so you can monitor the blood pressure real time. It's a lot more accurate than a blood pressure cuff on the arm. So on top of all of that, the doc might be throwing in a central line as well. So you're gonna have to be managing that and drawing blood, getting labs. And then also, if you're the primary nurse, you're also responsible for all the charting. So hopefully you have a good team. Like I have a good team, and usually you're not the only person in there, you have help, but technically you are responsible for all of that stuff. So that's like a typical post-ROS patient. I mean, there's other things you could have like chest tubes and stuff, but those are case by case. So, but that's what nurse means when they say we fill up all the holes, and that's what we do down in the emergency room.